babies. Well, here to discuss these developments further is former FDA Associate Commissioner Peter Pitts. Thank you for joining us.
My pleasure.
The nation has been dealing with supply chain shortages for well over a year, but it's now hurting America's youngest, infants. First, your reaction to President Biden's decision to invoke the Defense Production Act and his Operation Fly formula.
Well, unfortunately, I think the White House has been slow to really engage on this issue. It's really should have done a lot more in February. The Defense Production Act is saying that the suppliers of the materials of baby formula have to prioritize the manufacturers of baby formula for materials. And that's fine, except that the baby formula components are corn syrup and rice starch and protein derived from cow's milk, three commodities. There are no shortages. So while I certainly appreciate the president's decision to take the baby formula seriously, invoking the Defense Production Act isn't going to really help at all.
And it's interesting because Biden's director of the National Economic Council, Brian Deese, blamed private companies for the baby formula shortage. And this actually leads to my next question, because Abbott Laboratories closed its Michigan plant earlier this year after issuing a voluntary recall due to safety issues. But the White House says a deal is near to reopen Abbott formula. But should parents be concerned if they purchase baby formula manufactured by that facility?
Once that facility reopens and gets back up to speed, those products will be safe and effective. The FDA has been on the premises since February, identifying and working with Abbott to remediate all those problems. So once those products hit the supply chain, they absolutely will be safe and effective. But as far as who's to blame for the shortages, Abbott is the major manufacturer of baby formula here in the U.S. That plant went offline entirely, in addition to the recalls, in February. So, you don't need a mind reader to figure out that when you take the major manufacturer offline, you're going to have shortages.
And to follow up, where do you think the FDA went wrong that led to this shortage?
Well, the FDA did all the right things relative to closing the plant down and working with Abbott to bring it back up to speed. So they absolutely need to shut this plant down. It would have been a regulatory malpractice to leave it functioning. They did reach out to the other manufacturers immediately to get them to ramp up production, and that's good, but that took a while to get up to speed. But they also should have contacted pediatricians and let them know what might be happening so they could be part of the solution. They should have contacted retailers to put in place procedures so there wouldn't be hoarding or panic buying. They should have talked to American parents and been honest with them. Because I think one of the lessons learned from COVID-19 is that when you tell people the truth and you're transparent and you keep them posted as to what you're doing, they may not like it, but they trust you. And this was a missed opportunity, I think, to build trust in the FDA and in government more broadly.
And FDA Commissioner Robert Califs is set to testify today about the baby formula shortage. Do you have any specific questions you would like to hear lawmakers ask, or expectations? Because we know other officials will be testifying as well.
There's a great Japanese saying that says, "Don't fix the blame, fix the problem." And with most hearings on Capitol Hill, and he's testifying in front of the Senate tomorrow as well, people want to take a cudgel and beat people over the head with it. And there's a degree of that's okay. You want to wake people up. But I think the solution to the problem is recognizing that we have a consolidated business. Baby formula is a high volume, low margin business. And one of the ways to avoid these types of problems in the future is to make sure that the factories remain in compliance. And that means more money for the FDA for more robust and regular and surprise inspections.
And it's interesting because Caliph said the FDA doesn't even know where foreign baby formula might be coming from. When you hear that statement, what goes through your mind?
Well, I thought it was a non-judicious comment. I mean, what the FDA should have done back in February is recognize that there were going to be shortages, especially for those products most needed by babies with metabolic issues. And in February, put procedures in place to bring in foreign manufactured baby formula. And the FDA didn't do that until about 10 days ago. So I think that there were steps that could have been done that weren't. The FDA was focused on getting this plant back up and running, which is important, but there were other things that were important as well. And clearly, I don't think the president really understood the seriousness if he was told at all. So I think that part of the questioning from a Capitol Hill perspective is kind of what did the president know and when did he know it?
And that also leads to my next question, because we know about the Abbott Laboratories, that plant in Michigan that was temporarily suspended or shut down temporarily. But when the FDA closed the Sturgis facility, why didn't they immediately develop a plan for the potential importation of foreign baby formula? it seems like they waited until the last minute when it was affecting families.
They should have, they didn't, and that needs to be discussed, I think, at these hearings.
All right, well, we'll have to see what comes about. Again, Peter Pitts, a former FDA Associate Commissioner, thank you so much again.
My pleasure.